about metabolic syndrome.
Um, should I first of all wait? Can you go back a slide? First of all, I'd like to ask class: does anybody may know what this would mean, the metabolic syndrome? Does anybody have a clue?
I think it has to do with obesity, maybe.
Yep, that's correct.
You're on point.
Any other guesses?
Okay, so metabolic syndrome is basically the combination of diabetes, hypertension, obesity, and dyslipidemia. The syndrome puts you at greater risk of getting coronary heart disease, stroke, and other diseases relating to the blood. Having all three diseases, which are diabetes, hypertension, and obesity, is particularly dangerous. Here are signs of the metabolic syndrome. And by the way, the difference between signs and syndrome and symptoms is that signs are observed by the physician, while symptoms are told by the patient. So low HDL cholesterol, which is the HDL cholesterol must be high in order to get a healthy life. High triglycerides, hypertension, insulin resistance, and visceral obesity. Visceral obesity.
I have a question.
Go ahead.
Um, what does a visceral mean?
Visceral.
Mhm.
Honest,
Visceral obesity.
honestly, I'm not afraid to say that I don't know exactly. I might have to search that.
Visceral obesity comes from visceral fat, the type of fat that's bad for a person.
Oh, okay, okay,
Yeah, there you go. Thanks, Dave.
okay. Thank you.
Just real quick, visceral also has a English application. It usually has to do with the nervous system, something with your nerves. That's visceral. So I don't know if that's what it's talking about here, but something to do with your nerves.
It's relating to the viscera.
Yeah, okay, yeah, that makes sense, I guess. Good question. Good question. Keep it going.
So, in men, their waist circumference needs to be 102 centimeters or more to get metabolic syndrome, while it is 88 centimeters in women. High triglyceride levels, which is a type of fat found in your blood. When you eat, your body converts any calories it doesn't need to use right away into triglycerides. The triglycerides are still stored in your fat cells. So, high triglycerides and low levels of HDL, which the normal cholesterol in your body leads to atherosclerosis, which is the buildup of fats in the artery walls, or plaque in other words. High blood pressure, that is 130 over 85 or higher, uh, are one of the other symptoms. The inability to control blood sugar levels, the increased risk of developing blood clots, which is the clump here, of blood turned into a solid state right here. Uh, Deep vein thrombosis is a serious condition that happens when a blood clot forms in a vein located deep inside your body. That's another sickness that we might talk about in later days. The tendency to develop irritation and swelling of body tissue or inflammation. All these are symptoms of metabolic syndrome.
Okay. So what causes this metabolic syndrome? Well, basically, if you are unhealthy, there's no other way. Like being overweight, being obese, and lack of physical activity are the main causes. Um, it is also linked to insulin resistance. So it's diabetes. As we said, it's a combination of conditions. Being obese is one of the conditions. Being diabetic is one of the conditions. Uh, these are two causes. And type 2 diabetes, one of the causes is being obese. So you could say that the main cause of this disease is being overweight or obese. Um, blood sugar. Okay, it's just saying that the type what type 2 diabetes is. I'm pretty sure everybody knows what type 2 diabetes is by now, in which I guess I'll still go through it again. It's when insulin, your cells become resistant to insulin, or the insulin is not effective in your body, and your cells cannot take in the glucose, and then the glucose builds up in your blood. Right, next slide.
And by the way, to calculate if you're overweight, search on Google body mass index calculator to calculate if you're overweight or underweight or normal,
Yep,
just to make sure that you're physically active.
Yeah, you're like not any weight. Like there's no specific weight that you have to be in order to be overweight. It's your weight and relevant to your height and like your body type. So maybe someone who's really tall, he can have a really big mass, big weight, but that weight is regular to him because he's very tall. If a shorter person has the same weight as this tall guy, he's probably going to be obese because he does like because he's shorter, basically. All right, next slide. Okay, what are the risk factors? What are the things that you need to look out for uh, in order to prevent this disease? Um, First of all, your age. The older you get, the more the risk increases. So basically, take care of your body as you grow up, so nothing happens to you. Basic. Um, your race. This topic really interested, like caught my attention because like why would your race affect if you would have a disease or not? Science, I did some research, and scientists don't know exactly why, but statistically it is greater for certain races. Um, would anybody like to make assumptions on why this is? Because I've been trying to figure it out. Hello.
Maybe these races have weaker immunity. I don't know. Maybe they weren't susceptible to the disease
It's
ever until recently. I don't know.
it's not a term of immunity because it's not a virus
Oh, true. Yeah.
or any.
Maybe it's because of the way each race, the favorite food of each race, or something like
Yeah.
that.
True.
Yeah, I've thought of that as well. Maybe like the rituals and traditions of certain weights and the type of food they eat and the like certain traditions of each race. Maybe that's the cause. Some scientists say it may be genes, but I'm still not sure. Um, I don't know what any other possible reason for why your race would be like. Why would like you have two people of different race? Why would one be more prone uh, to this disease than others? Um, and another thought that I've had is maybe because of let's say social status. I don't know if that makes sense or not, but like maybe a certain race is more economically inclined and they have uh, more access to healthier material or like treatment. All right. Anyway,
I think some like cultures, it's like they see it as good luck if they're like overweight or something.
possibly.
Like maybe that's the norm is for them to be overweight than to be like in a normal or in an underweight weight range.
So they become overweight or obese on purpose.
Yeah,
Maybe.
like I watched this one documentary in this one like village in Africa, I think. They like force some young kids to eat a lot or something. Like I forgot why, but they wanted them to become overweight in the end. But I just forgot the like purpose of why.
Possibly. Yeah, in my mind, the main, I feel like this is my opinion. I feel like if like different races have different access to different food. Like for example, maybe a certain race eats a lot of fast food than another race which eats home cooked food. So that's probably a reason. I'm not sure though.
May I
Anyways,
say something? Or
yeah, sure.
if I butt in. Um, I know from reading, I think I remember that African Americans tend to have less potassium in their bodies than white people do.
Yeah,
So
I've seen that in research.
yeah, is like linked to type 2 diabetes. And so on average, they may be better than white people at making potassium. And then Asians, especially Southeast Asians, like Indonesia and Malaysia, they have higher rates of obesity because they eat a lot of rice and they have a central fat distribution that results in insulin resistance in their populations. So that, but as you said, I think the key point over time and evolution is diet.
Yep. Yep.
Yeah.
All right. Okay. So certain ethnic groups are more prone to the disease, such as Asians and African Caribbean people. Another risk factor would be other health conditions. If you have another disease, maybe that would mess up with your mess up with your blood pressure and anything. Such diseases are cardiovascular disease, which is in the heart, non-alcoholic fatty liver disease, and uh, polycystic ovary syndrome, which is in the woman. In women, no, I say in the woman. And so, and health risk factors also include um, stress. If you're like it's a small chance, but uh, being like anything to mess with your blood pressure is considered to be a risk factor. Stress is a risk factor. Too much caffeine is probably a risk factor because it messes with your blood pressure. So basically, there's a lot of things that you need to look out for. It's not only these conditions. Next slide. All right, preventing or reversing this metabolic syndrome. Okay, let's say a patient has metabolic syndrome, and you're the doctor. What do you do? Basically, you just make the reverse his lifestyle, make it a healthier lifestyle. That's the best solution to this problem. There may be other solutions such as like tablets or like in the worst cases surgery, but the best um, way to reverse this syndrome is by making lifestyle changes to have a healthier life. First of all, um, lose weight, uh, reverse obesity, exercise regularly, eat healthy. This is the basic stuff. Um, and if the patients, and you could also suggest the patients there's like balanced diets and certain foods for this particular syndrome, like to regulate everything. So maybe you need to look out for those types of food, even if you don't have the disease and you want to prevent it. You could do all of this stuff. Well, smoking and alcohol, you shouldn't even do it in the first place. You don't need to get alcohol to do to stop. Yeah, and any questions? All right, next one. All right, video.
Now we're gonna watch a video about metabolic syndrome. I think my audio is not here.
I think you should do the audio. Yeah.
Yeah.
What is metabolic syndrome? Metabolic syndrome is a group of conditions that make a person more likely to get heart disease or type 2 diabetes. How is metabolic syndrome diagnosed? To have metabolic syndrome, a person must have at least 3 of these 5 conditions. 1. Waist circumference for abdominal obesity. A waist circumference of equal to or greater than 102 centimeters in men and equal to or greater than 88 centimeters in women. You're yet 1 point. 2. Fasting blood triglycerides. Triglycerides are fat-like substances in the blood. You have high triglycerides if your triglycerides are higher than 150 milligrams per deciliter. 3. Cholesterol levels. HDL is the good cholesterol. That's because having high HDL levels lowers your risk of heart attacks and other health problems. You have low HDL cholesterol if your HDL is less than 40 milligrams per deciliter if you're a man, or less than 50 milligrams per deciliter if you're a woman. 4. Blood pressure equal to or greater than 130 over 85 millimeters of mercury, or drug treatment for elevated blood pressure. 5. Fasting plasma glucose, FPG, equal to or greater than 100 milligrams per deciliter. All the cells in your body need sugar to work normally. Sugar gets into the cells with the help of a hormone called insulin. If there is not enough insulin, or if the body stops responding to insulin, sugar builds up in the blood. If your blood sugar is greater than or equal to 100 milligrams per deciliter when tested after you have not had anything to eat or drink for 8 hours, you get another point of metabolic syndrome. Why is metabolic syndrome important? Metabolic syndrome is a group of risk factors that raises risk of heart disease, diabetes, stroke, and other health problems, and it makes frequently serious and long-term complications. Hardening of the arteries, atherosclerosis, diabetes, heart attack, stroke, non-alcoholic fatty liver disease, peripheral artery disease, cardiovascular disease. How can metabolic syndrome be prevented? You can lower your chances of getting metabolic syndrome by losing weight if you are overweight, eating lots of fruits and vegetables and low-fat dairy products, but not a lot of meat or fatty foods, walking or doing some form of physical activity on most days of the week, and in general, being as physically active as possible, quitting smoking if you smoke. How is metabolic syndrome treated? Diet. Healthy diets that can help you lose weight include the Mediterranean diet. This diet is high in fruits, vegetables, nuts, whole grains, and olive oil. It can help to lower your weight, blood pressure, and blood sugar and improve lipid levels. The DASH. Dietary Approaches to Stop Hypertension diet. This diet is low in salt and fat. It includes 4 to 5 servings each of fruits and vegetables and 2 to 3 servings of low-fat dairy products per day. This diet can lower your blood pressure, weight, and blood sugar and improve lipid levels. A high-fiber diet. Increasing fiber to at least 30 grams daily can lower blood pressure and weight. Fiber is normally found in beans, grains, vegetables, and fruits. Table 2. The nutrition label on packaged foods can show you how much fiber you are getting in each serving. Figure 2. Exercise. Doctors recommend that people exercise at least 30 minutes a day on 5 or more days of the week. If you can't exercise for 30 minutes at a time, try to exercise for 10 minutes at a time, 3 or 4 times a day. Brisk walking is a good choice. Medicines. Doctors often recommend medicines to lower blood pressure, blood lipids, and blood sugar.